program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
BronxNet. Your voice, your views, your vision.
Good evening. I am Errol Schneer, Bronx Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. We welcome you, our many viewers, to HealthBeat, and as always, encourage you to continue participating in the program by calling 718-960-7241 with any questions you may have. That's 718-960-7241. We promise to do our very best to keep you medically informed and healthy by discussing the medical topics that are of interest to you. Please tune in every Monday evening from 6:30 to 7 p.m. on Channel 67, and you can also find out more information about Bronx Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx Lebanon's Vice President and Medical Director, and I will be discussing the critical role of the ER in our healthcare system.
Yes, Errol, the emergency room is among the busiest places in any hospital, particularly those in inner city communities. Joining us this evening is Dr. John Coffey, Chairman, Emergency Medicine, Bronx, Lebanon, and Mairead O'Regan, Director, Emergency Department. Both of these individuals are highly experienced in the ER field with extensive level of expertise.
Now, before we hear from both of you, let me once again encourage you, our viewers, to call in with any questions or comments you may have. The number to call is 718-960-7241. That's 718-960-7241. And please call us. Now, let me begin the program by asking you, Dr. Coffey, to provide our viewers with a general overview, a virtual tour, if you will, of what the ER at Bronx Lebanon is about.
Well, the ER at Bronx Lebanon is a very busy and high-quality emergency department located on the Grand Concourse and Mount Eden Avenue. We see approximately 137,000 patients per year, all manner of ages and all manner of presentations. We have a large physician group of board-certified doctors, approximately 57 in total.
Right.
And we have how many nurses, Mairead?
115.
115 nurses.
So it's a very busy place.
It is.
It's a very busy place. We have several different teams, including a pediatric team in separate area. We have an urgent care area during the day, and we have a high acuity team, as well as 3 intermediate acuity areas. So we're high quality.
Well, I think you answered my question already, but I'll ask you just the same. Maybe you can repeat it. Just how busy do you think our emergency room is?
Well, Dr. Gums, it's actually one of the busiest emergency departments that I've worked in. From the time that the staff start in the morning till the time that they finish their tour, they're on the go. There is always something happening in the department, whether it's, the general assessment of greeting someone coming through the waiting room or with the ambulance, the nurses constantly rounding. It really is on the go, and you have to be ready for everything.
The second part of my question, what sort of doctors do you have populating the emergency room? So maybe you could not only tell me about the physicians that are in the emergency room, but maybe what you bring down every
Absolutely.
now and then.
So in addition to the emergency physicians, of whom we always have no less than 4, and during the midday as many as 12 throughout the course of the day, we have all manner of services and physicians in the hospital. So we have orthopedics, we have cardiologists, we have kidney doctors, and ENT. Every possible specialty is available at Bronx Lebanon. And of course, when needed, we call them.
And of course, you rely on the emergency room and other areas too. I mean, the X-ray department, I mean.
X-ray department is right next door to us, so it's very accessible in terms of getting X-rays or sonograms or CAT scans. It makes it very convenient. So whatever testing is necessary, we take care of.
Okay.
Now, you mentioned pediatrics. Is that a separate part of the ER at Bronx Lebanon? How does that work?
So pediatrics is part of our department, but they have a separate area
Right.
so that the children can be seen independently of the adults. So it's sort of just across the hall, and we have our own staff of physicians and nurses who are specialized in pediatric ER.
Which leads me into the next question, which is really, what are the special programs that you have in place now at the ER? And I'll start with you.
Well, pediatrics, of course.
Right.
We also have if you're having a heart attack, we call it a STEMI program, where we can actually get you to the cath lab quickly to do interventions. We have a sepsis program, so, for big infections that we can treat you quickly.
Right.
Stroke program.
Stroke program is very big with us. We are a stroke centre, and we can actually give you the medication that you need.
These programs have patients who come in and need treatment within a certain time.
That's
you
right.
meet all of this criteria.
We do,
Absolutely,
and we
yeah.
monitor it very carefully. We're very much into looking at our own ongoing internal performance and making sure that we meet our times always. So that's part of what we basically do daily.
In each of these programs, we coordinate very closely with inpatient services. So, for example, in the heart attack program, we're very coordinated with cardiology, the cardiology attendings, and it's essential because the time from the patient arrives to the time that they are in the cath lab and have their ballooning and stenting done has to be under a certain time limit, and we actually have very excellent times.
And that's the same with the stroke unit.
Stroke unit,
Yes.
we have to coordinate with the neurology team as to whether or not we're going to thrombolyse a patient, give them a clot buster. In each of these scenarios, so if it's a trauma, we work very closely with the surgical team.
Yeah.
ICU team is involved in
And
all
you're
of these.
also
The
monitored
coordination
by
is-
the Department of Health on some of those issues, right?
Indeed,
Yeah.
and by
Right.
CMS and
Yes,
other
right.
agencies, absolutely.
Okay, what are some of the common? You sort of mentioned it already, but what are the common problems that you see in the adult and in the pediatric unit that we see?
Well, we actually see everything. So anything from your basic headache to the patient that's actually having a stroke. Coughs and colds, because we have our own fast track area. Abdominal pain,
Chest pain would be
chest
common.
pains.
And every now and then we have
Syncope.
exotic diseases also that we see.
We
indeed,
do?
Absolutely.
Yeah.
Diabetes and complications of diabetes would be common, various forms of infections, bumps, bruises, fractures. There's nothing that we don't see.
And of course, measles, certainly on the uptick at the moment. So we're very vigilant with at triage that we're checking.
That's right, yeah.
Do most people come in by ambulance, or do they walk in? How does that work?
Approximately 80% arrive by walking in, and approximately
Really?
20% come in by ambulance. That would actually be the breakdown.
80-20.
80-20, yeah.
And it really doesn't
Right.
matter how you come in. You're still being assessed by a nurse, and you are seen in the order of your urgency. So if you walk in or whether you come in by ambulance, there is a professional nurse to greet you, to assess you, and then to liaise with the physicians on your care.
Right. And then based on the level of acuity, that's how we will
You work with
prioritize
this,
the
yes,
different
yeah.
cases to be seen by the physician.
Okay, so how do you explain that to the patient when I walk in, and I'm not too sick, but I see several other people coming and getting treated ahead of me? How do you make sure that's explained?
It is
Yes.
difficult to explain because every
Everyone
person that comes to the department is ill, regardless of what's wrong with them, and they do want to be seen timely. But we assure every single patient that our physicians, first of all, know that they're there, and secondly, they will be seen as fast as we possibly can see them. But, every patient needs a certain amount of time, and people understand that. As long as we keep them updated with
right, yeah.
with
That's what I
what's
wanted to
happening
say.
And
here.
that is the key, that through explaining and updating, you find that patients are very understanding of the situation. And naturally, a heart attack is going to have to take priority and be seen earlier than a bump to the elbow.
Errol has a nice question for you.
Sure.
Okay. One of the things we see a lot on television and even in the films is a certain role for the ER, and it's very dramatic. And what I was really interested in knowing, and I'm sure our viewers are feeling the same way, how does your ER compare to the ERs that we see on television? Is there a lot of drama associated with it?
Well, I'm not so much drama. I'd say the high pace, that, different stories are turning over all the time because every patient is different. So the staff have to multitask and continue to do things quickly.
I think the teamwork aspect, people working closely together and rapidly to take care of patients is very much the same. And patient and our staff work very closely together, so there's a certain intimacy and connection that's required in order to work effectively under such high-pressure circumstances.
Right.
Perhaps now would be a good time, Mr. Regan, for you to ask you some of the many challenges that nurses face in the emergency room. And I don't mean that Dr. Coffey gives them a hard time. I mean, what are unique problems
We work together well.
Well, I think the first challenge that any nurse in the ED faces is that is the assessment. So it's the nurse that actually will help set the tone for someone's visit. So their assessment skills have got to be on point, and their ability then to communicate with the patient what is actually going on and why things need to be done in the order that they need. Yeah. And then, trying to encourage them to, change lifestyles. We do a lot with education. So there are multiple challenges, but most of it revolves around good practice.
But it's probably a little harder for the triage nurse, isn't it?
It is hard because you've only got, about 7 minutes to determine the severity of the illness that someone comes. So you're trying to tease out information that often people don't think is important.
Okay. We have a question. Donna, you're on the air. You have a question for these good people?
Donna, you're on the air.
What do you have to do to become an ER nurse?
Good question.
Is this a good thing to do, or are there shortages in this area?
Excellent questions.
Did you hear it all?
Hi, Donna. Yes, we are actually looking for ER nurses. So you need to go to nursing school, of course, complete your degree, and we do like to have at least 1 year med-surg experience, but we have taken new grads and have managed to transition those very successfully into really good ED nurses. It's actually a great field to go into.
There was a second part to the question, Donna, right? There was a second.
I just wanted to know if there was a shortage of nurses in this area, and she just said no, there wasn't.
Okay, yeah.
Well, there is a demand for nurses in ER. It is a real specialty in and of itself. You become, by going into emergency medicine, either as a doctor or a nurse, you become extremely well-rounded, and you become able to deal with any and all problems that present. So, but we're always looking for good ER nurses, that's for sure.
Thanks for the question, Donna.
Okay. Now, how has Bronx Lebanon's ER changed over the past few years? I know there's been a lot of expansions. Perhaps you can share that with our viewers.
Absolutely. Well, I've been at Bronx Lebanon now for 11 years, and we've done many things to improve.
12 expansions.
We've done about 12, that's true.
But the expansions are very good for the community.
It's very good for the community. We have added multiple new areas, each of which ends up being a team in and of itself.
Right.
We redid the adult and pediatric waiting rooms to more than double their size, and they're very nice and spacious, which is great. Right. Last year we redid the main central area as well as the workstation. We took down all the walls. It's much more effective and open as a space. And most recently we doubled the size of our critical room. So we went from 4 beds to 8. And as we speak, there is a whole additional team where we'll be able to take care of 20 more patients at any point in time. Under construction, should be done in about 2 months.
Good. So let's pause now for a short break, and when we return, We'll continue our discussion as well as take calls from you, our viewers. Once again, the number to call is 718-960-7241. That's 718-960-7241. And please call us.
In this year of neonatology, we recognize the extraordinary and successful life-saving efforts of our neonatal team. Every day, they are truly making miracles happen for the tiniest of babies.
We have saved thousands of babies throughout the years. There is nothing more satisfying than knowing that because of our care and attention, they can live their lives to the fullest as healthy young adults.
We care for each of our newborns as if they were our very own, including educating parents and assisting them in navigating the new journey with their child.
Seeing is believing, particularly for Norma Rodriguez and Raul Velasquez, the proud parents of triplets Nyla, Nilani, and Nayeli, successfully delivered by Bronx Lebanon's high-risk obstetrics team.
Gently, very good. Okay, very good. Now we'll breathe out. Beautiful, very fine.
Triplets are a rare occurrence. The baby girls were delivered by a C-section in excellent condition. They received follow-up care in the neonatal intensive care unit because of their low birth weight.
And when it comes to follow-up care for these triplets, as well as other neonatal graduates and newborns, Bronx Lebanon's pediatricians are making sure.
First year of and it's a great joy to us that we're able to tell parents that they have a healthy child.
There are times when premature infants have swallowing, hearing, or breathing issues. That's when Bronx Lebanon's ENT specialists are called into action.
Our physicians, audiologists, and speech-language therapists work closely with neonatologists in assessing these medically fragile babies. When necessary, we correct the problem and also instruct parents on using safe feeding practices.
Vision is equally important for newborns.
In premature babies, the retinal blood vessels are at risk of developing abnormally, which can lead to blindness. We are one of the first hospitals in the nation to offer laser treatment to correct this condition.
The bottom line is that Bronx Lebanon is always there for its newborn patients and their families, as well as for the community. Its ER is a perfect example.
Our adult and pediatric emergency departments see more than 137,000 patients annually. We respond effectively to problems related to newborns, children, teenagers, and of course our adult and senior citizen population.
Bronx Lebanon also continues to lead the way in anesthesiology, dentistry, family medicine, neurosurgery, orthopedics, pathology, psychiatry, surgery, radiology, nursing, and long-term care. Its Bronx Care Network, including a soon-to-be-completed 9-story ambulatory care facility, as well as a new life recovery center for individuals that suffer from chemical dependency, is fulfilling Bronx Lebanon's role as doctor to the community.
Welcome back to HealthBeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7241 with any questions you may have, and we will certainly do our best to answer them. That's 718-960-7241. Now, before we continue our discussion, I understand we have a call from our audience.
Robert, you're on the air. You have a question for us?
Yes, doctor. Thank you very much. My question is, what is the estimated wait to see a doctor once when the emergency room?
What's the expected wait?
Wait time.
Tell him the truth.
Mm-hmm.
Well, it's highly variable. Depends on the level of your presentation. If you're quite sick, then we get to you immediately. So if you arrive by ambulance having a heart attack, it's quicker. If I had to give you a number, I'd say between 45. If it's a non-acute problem, it might take 45 minutes. But if it's an acute problem, we'll see you immediately. So we have to, and it also depends upon the time of day. So I'm kind of giving you the numbers at the busiest time of day.
So if someone comes in with a flu or a cold symptom, that's a little longer.
That might take longer. That could take 45 minutes or an hour.
And it depends on
the time of day. So if you come in the morning, it's quicker. If you come in the middle of the afternoon on a Monday when it's packed, it will take longer.
Robert is trying to say that he tries to do his best.
But I can tell you that we have perhaps the best times in the Bronx in terms of arrival to seeing a physician.
No, that's great.
Thank you for the question.
A question we often ask our panelists is to share their respective backgrounds with our viewers. In other words, what interested you in pursuing a career in the ER area or in the other areas that we interview panelists on? And I'll start with you, Miss Reagan.
Oh, well, for me, it was actually my dad.
Really?
My dad, when I was young, got really ill. And I remember him always telling me about how this nurse stood up for him in the hospital. The physician wanted to send him home. And she basically said, oh, no, he's got to be admitted. And I always remembered that, so I wanted to be a nurse to help people. The ED, I just think that no 2 days are the same. It doesn't matter. Your day can start as you think a normal day, but then it can, progress into anything from delivering a baby to helping someone that's having a heart attack or making someone with a general headache just feel a little bit better.
Right.
Dr. Coffey?
Well, I think I knew I wanted to be a doctor since age 7, but what convinced me to go into the ER was that after college I went into the Peace Corps. So I was living in a very extremely rural area for 2 years right after college, and there were an enormous number of health issues that were brought to my attention at the
Tell us
time.
where that was.
It was in Nepal, so in the Himalayas, just north of India, south of China, and that clinched it for me. I came back, I decided I wanted to be a physician, and I wanted to have skills that allowed me to take care of anybody that showed up at our doorstep, so to speak, which is actually what we do in the ER.
Now, in terms of the training for an ER physician, you're obviously extensively trained. What does that mean?
Well, medical school, first of all, is a 4-year process, and then after medical school, you do your residency. And for emergency department, it can be a 3 or 4-year training program at specific institutions where you're trained in how to deal with everything that you will see and deal with in emergency medicine. And then after your 3 or 4-year training program, you go out, find a position, and the real...
A little bit. In terms of when someone comes to the emergency room, when would they know that they should come to the emergency room?
I think that, when people feel that they need care, they should come to an emergency department or see their own doctor. I think that it's very important that you are comfortable with knowing that we are there 7 days a week, 24 hours a day, and it doesn't matter what's wrong with you. We are very happy to see you.
You want to answer that?
Well, I completely agree with what Mairead said. I think if you're having symptoms and you're worried and you feel it needs to be addressed immediately, then we're there for you in the emergency department. If you feel it's lower level and you can take your problem to your own physician or clinic, that should be fine. But anytime you're not certain and you need things to be addressed soon, the emergency department is the place to go.
You're trying to say we take all comers.
We absolutely take all comers. That's a hard and fast 100% rule.
Right.
Okay.
Now, in terms of the patient flow process itself, if you were called and asked about the waiting times, how long does a patient have to stay in the ER once a doctor sees them? What's the average time there? And how does it work in terms of admission versus discharge?
In terms of our process, when you arrive at our emergency department, you actually get registered. It's called a mini-reg within about a minute of arrival. So that gets you into the computer system. And then registration actually passes those cases to the nurses who are the first ones to see you. That process is called triage. After triage, the nurses have decided your level of sickness, and they decide which team you're going to go to, and then the doctors attempt to get to you as quickly as possible. Doctors will begin their workup. Some can be quick if it's a simple problem. Some situations may require testing, EKGs, CAT scans, x-rays, blood tests, and then a decision needs to be made based on your level of sickness, whether we can treat you and send you home or at home and then to follow up with your physician. And we actually have a very good clinic system within the Bronx Lebanon network, and we make appointments for you. Or if you need to be admitted to the hospital or to observation services. Once we admit you to the hospital, it takes about an hour and a half to 2 hours to get from the ER to your bed. We actually have very good times for getting patients into their beds.
Great.
I don't want to be a bad patient, but I have a problem with some of the emergency rooms. I think there's no one who really spends the time to update the patient of why there is a delay sometimes. Do you have that as a problem in your emergency room? Or you have solved it?
Well, I think like most emergency departments, we were guilty of that, but we have been working very hard to really improve our communication with our patients. We have our techs now doing health rounds every hour. Our nurses are visible on the floor. The stations, as Dr. Coffey said, have all been opened up. So everything, the physicians, the nurses are all completely viewed by the staff.
And the communication begins really in the waiting room where everybody gets a handout which explains our process. And then as Maria said, communication is the key.
Right.
And so,
Right. Now, what about some of your success stories? That's another question that we frequently ask our panelists. Can you share some success stories with us? And I'll start with you, Dr. Coffey, and go to you, Ms. Regan, following.
Well, I mean, there are success stories every day.
Every day.
We, in the adult ED, for example, we're seeing about 300 patients a day, and in that mix, there are always tremendous success stories. You have patients who come in with chest pain, and EKG is done either en route or on arrival. We see that they're having a large heart attack. We immediately call the cardiology attending. They rush down. We get the patient up to the cath lab. They get a stent, they get a balloon and a stent, and they're cured.
So with stroke patients too, right?
Same with stroke patients, so where they'll come in with a dense hemiplegia. We call the stroke team, we get our CAT scan, blood thinners are given, and the patients recuperate. So every day there are stories of success.
No, absolutely. Our nurses pride themselves on ongoing education. They go to all the ENA seminars. We actually had a nurse a couple of weeks ago actually picked up an aortic aneurysm.
So on that note, let me ask you one last question because we're running out of time now. We started the program with how the role of the ER should be defined in our healthcare system. I'll start with you.
It plays an enormous role. The emergency department is the hub of what happens in the hospital in many respects. We're frequently the main entry point for many hospitals. We're also the interface between community health and the acute care hospital. So a lot goes on in that emergency room, not only in terms of assessing and admitting, but in terms of treating people and getting them back to their community providers where the ongoing primary care can occur.
And on that note, let me thank you, Dr. Coffey and Ms. O'Regan, for joining with Dr. Gums and myself on tonight's HealthBeat television program.
Thank you for having us.
Most importantly, let me thank you, our viewers, for tuning in this evening.
In the interim, if you, our viewers, have a question or need assistance, I encourage you to call our physician referral service by dialing 718-99-BRONX. That is 718-992-7669. Or you can refer to our website at bronxcare.org. Good night, and we'll see you next week.
Thank you.
Your voice, your views, your vision.